The views reflected by any of the guests may not reflect the views of the podcast host. Some topics may be difficult for some listeners. Proceed at your own risk. This podcast does not replace psychotherapy or advice and is for entertainment purposes only. Welcome to Hopeology, Stories of Hope, Healing, and Resilience. My name is Christina McKelvey. Today we're going to be speaking with Dr. Max. We're going to be peeling away the different layers of psychodynamic therapy, debunking myths about Freudian and Jungian practices. We're going to kind of explore the intricate dance between resilience and hope, and how to have hope serve as a North Star in guiding someone toward their dreams in a realistic manner. You're not going to want to miss this episode. It's very cerebral. It was very awesome, and I loved it. Stay tuned. Welcome to Hopeology, Stories of Hope, Healing, and Resilience. I'm your host, Christina McKelvey. Today, we're going to be speaking with Dr. Kusovitsky. He's a psychoanalyst, and he's researched different ways that hope can bring meaning to people. How are you?
I'm okay. I'm excited to be here.
Excited too. Why don't you introduce yourself for us?
Sure. So I'm Dr. Kusovitsky. Obviously, Max is fine. I'm a psychoanalyst practicing in New York, New Jersey, tri-state area. And I guess what brought me here involved, as we previously discussed, is the relationship to hope and how it plays out in the frame of psychodynamic therapy or psychoanalytic therapy or just meaningful therapy, whatever people prefer to call it. And I felt particularly motivated to speak to and attend to how complicated it is. And especially when hope as a virtue is not the same thing as hope as it's played out in the therapeutic dynamic or the therapeutic frame. And it deserves to be understood in a much more meaningful way. It's complicated. It certainly can be a danger, and it certainly can be a wonderful, wonderful thing that fuels something like resilience in a person.
Can be a danger. I want to focus on that in a minute. But before we do, can you lay out the framework a little bit on psychodynamic psychoanalyst framework? Because I know some of our listeners, might be like, oh, I'm familiar with CBT or EMDR, all these different types of therapy. It's super saturated. So if you want to explain a little bit.
Yes, the alphabet soup of contemporary therapy.
Right.
So much. So I'm standing on the shoulders of giants who have said this better than I can, but essentially what depth therapy is, or psychodynamic therapy, is bringing awareness where it hasn't been before, bringing consciousness where it hasn't been before, saying the quiet parts aloud, essentially introspecting in a robust sense. That is to say, an appreciation of the unconscious landscape, which certainly exists, and by getting to know ourselves much more fully, by experiencing things that we might avoid experiencing through the nature of ego defenses, as it's called, or just keeping them out of awareness, we can facilitate an actual healing, resolution, as we would call it, in the sense of inner conflict that might not be felt prior to entering into a treatment like that. So a symptom, to speak even more simply, is not separate from the self. A symptom is part of the anatomy of one's own psychology. The metaphor often used is the fever. The fever, it can be caused by a multitude of pathologies, and you could take Tylenol to get rid of the fever, but that doesn't address maybe the infection. Or you could take another medication that is an analgesic and neutralizes the pain, but the pain returns and the inflammation returns, maybe sometimes with a vengeance. And so often people enter into what I would call a meaningful therapy or a depth therapy in service of understanding themselves, which is eventually what can give rise to not only hope, maybe not pun intended, but intended to say
Right.
but gives rise to the opportunity to heal that they might not have had otherwise or prior.
Okay. It sounds like the root, getting to the root of the issue as opposed to putting a Band-Aid on, getting to that root of the
Yes,
healing.
that is commonly used.
I
My
use it a
anxiety
lot.
about my anxiety sometimes is people, I want to stay as diplomatic as possible. I don't
Oh,
want to offend other forms of therapy, but
nah,
yes,
just kidding.
I tend to agree with that, in that the genesis or origination of
Mhm.
so many of what we experience as symptoms in today's world, or what the DSM organizes as symptoms, but without causality or etiology, is really important. Right, the symptoms exist: anxiety, depression, what have you, somatic issues, and so on. But if we don't dignify the reality of our own psychology, and saying that this is something that can actually generate suffering, or a point of suffering, we do our own humanity a really huge disservice. And I don't think any of that is an exaggeration.
Yeah, it's like the point of suffering. This is like the foundation almost. And it's more than, because when people hear psychoanalytic theory, I am having a hard time speaking today. Probably shouldn't have had that whole big cup of coffee before.
Yeah.
But when people hear about, like, they think traditional therapy, Freud, Jung, things like that, but
Yes, the
so
common
much more.
the what we say again. You're teeing me up for some wonderful classical refrains we use. They argue against the straw man from the horse and buggy era. So they say psychoanalysis is the same thing that, hysteria is a good example, the wandering womb or something. And as
Right,
if
right.
in my training, starting in the 2010s, as if that's what I was taught, even though that was something said obviously in I don't remember, 80s or 90s. And yet people argue as if nothing's changed in 110 years. But if the example we use as contrast, or to confront that, is people aren't bloodletting anymore. You don't argue against that. People aren't talking about the four humors anymore. People aren't arguing against that. But when it comes to psychology, and you say you're a psychoanalyst, people think, yes, that you're lying down on a couch and 7 times a week and giving away your child's college tuition to pay me so I could build my pool. And it's just, a lot of it is incredibly untrue and unfair, but it goes with the territory of doing the real work, as you were saying, of what gives rise to hope and meaning in somebody's life. It's a very serious responsibility.
Yeah, yeah. And I think there's a lot of, I don't know if animosity is the right word. That's not the right word, but maybe a wall up with it just because of Freud.
It's the right word. It's the
Okay,
right word.
it's the right word. But and I'm a therapist, and a lot of the adults I work with, I always go back to birth to five. We're going to do some birth to five work, early childhood work. We're going to look at what happened to you in the womb. We're going to look at, the generational patterns with your parents, and we're going to look at maybe some of these core beliefs as CBT. But I feel like you can't get away from doing psychodynamic work, even if you are aligned with other theoretical orientations. So I think it's the foundation, is my belief.
We would say that the reinvention of the wheel has been tried over and over the last 140, 130 years, and human psychology has not changed since the species began about 200,000 years ago. It's still the same. The drives, the what motivates us, animates us, mobilizes us, the hierarchy of systems in the brain, if you want to bring in the neuroscience stuff, it hasn't changed. And so to say that affect isn't fueling thought in this topography of the brain, to me, someone like me, is to sort of fib, is to sort of lie. And so we have to appreciate that these systems work in an emergent way, in a systematic way, and that psychoanalysis, or just call it meaningful therapy, depth therapy, appreciates the reality of how the brain and mind are supervened or mapped onto each other, and or just say how the heart, soul, spirit, mind, and brain are mapped onto each other. Again, we're trying to be as inclusive as possible. It ought not be a civil war.
Civil war within the fields. But yes, the heart, soul, brain, mind, all, like you said, are mapped on to each other. So I think that leads us to something you said at the beginning, that hope can be dangerous. And so my podcast is called Hopeology. I love hearing stories about hope, healing, and resilience. But I think I'm guessing where you're going to go with it. So I'm actually really excited to hear your perspective on what you mean by how hope can be dangerous. So let's delve more into that.
Sure. So to provide, I guess, some background and context, essentially although it's a nice soundbite, it's very pithy, is to just say that
I was just thinking that hope not to laugh.
It's true. It's a good soundbite. We'll get some clicks. Hope can be dangerous insofar as who's harboring the hope, who's generating the hope, who's ferrying the hope back and forth in the therapeutic relationship or frame. And of course, what hope means, let's get back to the individual, what hope means to the patient or the person. And hope throughout our lives plays different roles. The inability to construct hope, I think Rollo May said this, I could be wrong, is the genesis of depression, meaning you can't construct a future plan. The absence of hope in people's lives, and hopelessness and its symmetry to despair has been talked about by Mitchell and other analysts, and it's very real. And so the dangers of hope isn't that hope itself is some sort of spiky, pathogenic fall that's to be passed back and forth or to be avoided. It's to say that if it's utilized defensively, which is maybe a controversial statement, but it can be utilized as a preventative, a prophylactic, a membrane of sorts, it can get in the way of somebody's actual strivings towards potential. And so what that means is that, speak kind of more plainly, is that hope can be something someone holds on to, but it can be founded upon fantasy that is incongruent with reality. So the hope can be generated or originated within the mind, the spirit, the heart, as we were talking about, but it might not be congruent or mapped onto a potential reality for that individual. So if my hope, to speak very simply, if my hope was to be the King of England, and then I found out that I was born in the United States, or I denied a defense, that I was born in the United States, that could be quite painful. And that also can produce real symptomatology. I might get very depressed. I might lose my spark or vitality or resilience in life. And so hope is very different as a verb or as an actionable concept than it is as a virtue. And I think people get that conflated or mixed up all the time.
So to summarize it, what you're talking about is when someone has this false sense of hope, unrealistic expectations and realistic hope, like you mentioned, if it's my hope to be the King of England, but I was born in America and not even from, the royal family, right, then that's going to
I'm not, by the way.
Yes. Disclaimer, everybody.
Disclaimer,
I am not speaking to the royal family, but that would be cool if you know of anyone.
Would be cool. Yeah.
What brings you guys as hope? No. Yeah. So it's like setting up like that could be dangerous if we go back to that.
Right. And even the phrase of, can be quite controversial. Again, I'm sticking with diplomacy as best I can. Mm-hmm. Realistic versus unrealistic can be a controversial because depending on the person's personality, organization, or structure, or realm of where they're organized, to speak to dynamic principles, and neurotic and a borderland or psychotic, the realistic hope might be that they become King of England, President of the United States, Oscar winner, Pulitzer Prize winner, you name it, and it can be incredibly intoxicating and incredibly seductive. At the same time, and this is the hard part because the unconscious can have lots of paradoxes, it can be very defensive. So again, the King of England example is so powerful, where that person might need to believe that they have the capacity or potential, or maybe they've been wronged or slighted by the royal family, a funny topic today, and they really should be the King of England, Mm-hmm. And so people have these belief systems, which is, again, belief and hope go hand in hand. And so they can very strongly believe in a hope that might not be congruent, we would say, with who they actually are. There's a big difference between authenticity and a sort of fabricated sense of self, or a false self, or, an image, people might say as well.
Okay. So where do you draw the line between, okay, this false sense of hope is needed for this individual at this moment, to maybe we need to kind of delve into this more and help this individual know, well, this hope, this is not really realistic. Like, where do you draw that line?
So it's a really, really good question. But the classic answer is not a cop out, and I will elaborate. Is it's case by case, because I think by asking already recognize what you're asking, insofar as that hope or fantasy of hope might be gluing them together. And if I were to rob them of that, if I were to surgically excise it and remove it from the anatomy of their own psychology, they could genuinely fracture. That's not any hyperbole. It's not an exaggeration. Right. So the word we use is tact, which is to say there is an art in science, a tact to knowing when this person is amenable or available to appraising their relationship to that fantasy of hope. And let's say it's false, so it's not congruent with their way of being, or where they live, or whatever it might be, or their age, or you name it. Right. And the work of addressing it takes a certain arc of understanding. If it's, let's use lotto as a classic example. I'm going to bet, all my money and just win lotto eventually, so I don't have to worry about anything. That can be a fantasy of hope that can drive somebody. And if I said first meeting, hi, I'm Dr. Kusovitsky, let's get rid, you came here, you were referred by your husband or wife or spouse or parent because you're addicted to the lotto. I probably wouldn't say it that way, but we have to get rid of it now. The person would run out of the office. They'd laugh at me. They'd scoff. And so the work of establishing trust first and understanding and empathizing with the hope, again, and treating the hope as an actionable, serviceable fuel, almost like a gas station you bring to mind in this conversation. It has to be appreciated as a systemic part of what's fueling their vitality. And if I were to tell them, oh, that's all wrong, there'd be no work to be had. They would never trust me. They would never trust their relationship to their own perception, or they would never have the wherewithal to see the forest for the trees, let's say, and start to investigate what gives rise to that need for that fantasy of hope. And that's the danger. It has to be treated with, I would use the word respect, even if it seems outlandish. Which is a whole other conversation about treating somebody who might be more, can I use the word psychotic? I don't know anymore. We would use the word psychotic, but what I mean is very alienated from reality, like the King of England fantasy. My job would not be to convince them that the hope of becoming the King of England is bad or pathological. My work in speaking to understanding the hope and liberating resilience would be to help them understand where that comes from.
Help them gain that insight. So it's going to Rogerian theory. It's unconditional positive regard, meeting them where they're at.
Yes, it gets tricky. Unconditional gets I don't know how many hours you have today, but that's a tricky concept.
I keep throwing things at you. I don't mean to.
No, I would love to talk about it. I'll talk in Blue Streak about it, but there is certainly, yes, positivity, affection, but it's couched within the frame. So it's okay. And it's in my point of view, and take it with a boulder of salt. There's plenty of people who disagree with me. It is absolutely conditional. And it's conditional in the sense of that it has to be within the frame. Now, someone could say I'm misconceptualizing unconditional positive regard, and I'm no expert in Roger's work. But in my understanding, that positivity is more, I would just translate it and say the affection and respect and dignification, if that's a word, of the patient's psychology is where my emotional investment goes in the work, including all the stuff about hope and resilience. But it is conditional, meaning if they never came back, that's a condition. They have to attend therapy. That's a real one. They have to pay a fee of whatever variety. That's a real one. I have to be licensed in that state. So again, I don't mean to play, semantics, but it is conditional in my understanding.
Yes, no, that definitely makes sense. So it does make sense to like go back to the term respect, respecting the patient, respecting the individual. And like you said, it's a case by case basis. Where, as far as like, where do you draw that line? Like it makes sense why it would be dependent on the individual.
Right. It's really, and again, there's such a slippery slope again that invites the straw man arguments and invites the bastardizations and invites all the internecine, mutually destructive warfare in the field of mental health right now that I get very up in arms about, that motivated me to join this podcast because it ought not be there. I'm not trying to say one is better than the other. I'm merely trying to respect the reality of how these things emerge, what gives them life. And human condition is incredibly complicated. And it's what, your podcast, am I allowed to compliment the host? But it's admirable because hope is so much more complicated. I really, really, it means a lot to me, personally, professionally, because it's in my experience, it's treated, again, it's different than being a virtue. It's like saying everyone should be nice, or the golden rule, biblically. Right. There's a difference between the virtue of being nice versus actually putting effort in understanding somebody, or the effort in helping somebody, or even an apology. It's a great, classic and intuitive example. You could say you're sorry and do the same behavior over and over again. That's the virtue of contrition is not the same thing as, or the performance of contrition is not the same thing as actual contrition if you don't feel it. Right. And so if you don't experience hope in the dyad between the patient and the analyst or therapist, it can become a real danger. I'm not just saying that so that we get a lot of clicks.
No, yeah, I know it can be. And because I was reading an article, I think it was in Psychology Today, just a couple days ago, and it was perfect because it was like, oh, we're going to have, this podcast interview about how, hope can, instilling false hope, false expectations in someone can be detrimental, and it could hinder that resilience. And so again, it goes with that hope and resilience goes hand in hand.
That's actually, that's a very valuable point. I didn't consider consciously. And what I mean is that the virtue of hope or false hope, or it being ingratiating or being super complimentary or being a good mother, to speak classically to the patient, it's a very good point, can rob them of their own resilience. Because if you're not respecting the key word maybe today, besides hope, if you're not respecting their own capacity, their own right to self-determination, their own autonomy, or the points of arrest that preclude autonomy in the topography of their own mind, they might never reach a place of what I would call endogenic hope, self-generated or internally generated hope. And if that's absent, and I'm the one fueling it, and you depend on me to give it to you, we would call that an enactment. And that means you need better supervision or better training. I don't know if that should stay. You might need to edit that out. And
I'll research
in that sense, if otherwise, then you're robbing the person of their vitality. It's sort of it's the irony of, again, this conversation to me again means so much, and I think what you're doing is so powerful in the sense that it is that respect for the person's humanity that seems to have been lost in this alphabet soup of therapy, or in the focus on symptomatology. Eradicating symptoms is not in and of itself the goal, right? The goal, if there is a goal, we wouldn't necessarily use that word if I could speak for the whole field, which is silly. I can't. Is resilience and hope that's internally generated, or authenticity, striving towards one's own capacity, utmost capacity. Karen Horn, I would say, right? It's a moral obligation, a moral duty for the person to be able to become themselves. Many analysts, or many, not just analysts, have said that, philosophers and others. And hope, again, can be one of those engines, truly, that facilitates development. But if it's, again, treated as in and of itself a panacea of sorts, a false cure, without the respect it deserves, and instead kind of almost forced down somebody's throat in service of alleviating maybe my anxiety or my worries of being an ineffective therapist, I'm absolutely failing the therapy, and the person is not going to reach that point of what I would call as genuine hope.
Yeah, they become dependent on the therapist.
Again, I agree with you, but I'm very afraid to speak to that in terms of being respectful for other forms of therapy. I will say that, yes.
I'll interrupt you there. I don't think being dependent on the therapist, I think that is something a lot of different theoretical orientations warn against.
Yes, that's true. Yes. And analysts are very guilty. Please, this is not unique. Like analysts are immune. It's just, I think that analysts can be so obsessive about trying to understand things that that if they're modest enough, and if they've been in enough supervision and enough personal therapy, they're not going to allow that enactment to unfold. So right. Yes, dependence on the therapist is universal. You're absolutely correct. But it's about interpreting it so as not to let it become acted out without realization, without awareness. That's the big problem. And so if dependence, to use that example, becomes part of the frame of the work, then maybe the argument I would make in service of the conversation today is that hope can't be had by the person. Yeah. Because I'm harboring the hope that they themselves need to harbor. And when we spoke for the first time prior to this recording, that metaphor meant a lot to me. It was something you and I came up with together, in the sense of ferrying hope is incredibly powerful. And if you again force feed it and ferry that hope into the patient's harbor too early, they could run, right? Because that hope can be their hopelessness can be a defense against all sorts of potential growth. Similarly, if I hold on to it myself and I'm harboring the hope, all of it, on one hand, I could be the auxiliary source of hope, which is certainly constructive, or can be, but it also can be very defensive on my side. I don't want to give it to you. I don't think you're ready for it. Maybe I'm not realizing that I'm like a mother or father who never provided it. Who knows? But that is another avenue or another ocean to cross that very much plays a role in how hope is. I used the phrase before, a verb. Currently, I can't think of a better phrase. It's actionable. It's a verb. It's alive. It's dynamic, maybe is a better word.
Yeah, it's dynamic. It's ever changing, and it's needed. And I apologize to I have background noise. I'm going to try and edit that out, but I apologize if it's distracting to any of my listeners. But there's construction going on across the street.
I can't hear it.
Oh, yay! Hope and resilience. As you were speaking, I was thinking, like, what would come first? What would be needed? Resilience to instill the hope, or hope to facilitate resilience? And how, as a practitioner, can you encourage that?
You're blowing my mind. I've never thought of the order of operations, the permutation or combination of hope versus resilience. Can I take a moment to think?
Yes, you can.
Can I phone a friend?
Sure, go ahead. Just kidding.
I think resilience comes from hope. I don't know if there is. I have to think more clearly about it, but my knee-jerk reaction or my off-the-cuff would just be to say they go hand in hand. You need resilience is distinct from hope in my understanding, in that it has it's a capacity to manage and tolerate and survive what let's call negative experience, failure, pain, oppression, of any kind. I think of depression, suppression, repression, oppression, compression, these forces, maybe top down more than bottom up, although inhibition bottom up can be a big part of that. That to me is more in the vein of resilience being, again, actionable and a hedging against it or a fight against it. Hope, it's a really good question. I have not thought of it. Hope to me is more a pursuit forward facing. I see hope as more within the realm of fantasy, of an inner working model that provides somebody animation of their life, motivation in their life, mobilization of their forces. It's resilience to me seems more at bottom, if that makes sense, in the way that I can conceptualize it. Like, you need resilience and hope. And resilience is maybe what keeps you standing up in the face of, what's the word, the face of opposition, in the face of the combatant, in the face of failure. And hope is what allows you to put one foot in front of the other in pursuit of your own goals, dreams, development, and authenticity.
Hope are the shoes and resilience is like the arm, like the shield or something.
Yeah. Resilience is the internal capacity to face, manage, tolerate. Again, a lot of words come to mind. Forces that go against the self, maybe. And hope is the thing that keeps you going. To me, hope is you need resilience to maybe. So maybe there is an answer. Maybe resilience is what undergirds hope. If I see it vertically in the brain or in the mind, and hope is what helps you pursue. But without resilience, it seems like hope would flounder; it would fall. And resilience without hope would allow you to survive but not live.
Yeah, like you said, they're interconnected.
Yeah, they seem very mutually dependent in a constructive way. Yes.
And how can a practitioner, especially in the work that you do, help someone towards the resilience and hope?
That's another big question. You'd have to buy my book. I don't have a book.
I was like, really?
I wish. You have to attend my class on the weekends. It's $5,000.
Okay, I'll be there.
No, they go hand in hand. But I guess, to speak as simply as possible, the nurturing or cultivation of resilience. And you're teaching. Your questions are very apt, because you're sort of reteaching me things I haven't thought about as explicitly. Cultivating resilience is not the same thing as cultivating hope. Just like back to the King of England example, because shifting somebody's fantasy in service of a gravitational pull, if there was a planet outside of them that moves them towards a realistic goal, that is hope. And that evolution from a hope that is congruent with who they actually are and authentic and genuine and sort of self-sustaining is not the same thing as somebody who might lack resilience. Let's say life really has beat them down. Trauma there's a whole other conversation, but trauma is a real thing. And even though nowadays it seems extremely common, it's used very lightly, the word has a lot of meaning psychodynamically. And so if someone has unfortunately suffered a prolific amount of trauma, there might not be resilience to get them into a position of, let's say, uprightness to even combat their own inner conflicts or their own interpersonal strivings or their own pain. And so cultivating that is a different approach. They go hand in hand. They could be in the same session, as an example, with the same patient or with the same arc of the work. But one, to me, feels as though they're both having to be self-sustained and self-generated, but resilience might be more, let's say, I think in my experience, anecdotally, or in my cases, in the history of my practice, resilience is something almost, like we said, a prerequisite. Because if the person is in pursuit of some goal, but they don't have the capacity to tolerate rejection, very simple example, complicated but simple in the language, they might not ever pursue it. But the reason they can't tolerate rejection can be incredibly complicated. Another example would be that if that goal that involves rejection, they need to be a Hollywood Oscar-winning director or something. If that goal itself is false, or a defense against an absence of other wishes of accolade, affection, and admiration, then that has to be interpreted and understood as well. I think resilience seems to have, in my spitballing with you right now, resilience feels like it has more to do with, it seems more to do with depression, more to do with a compression of force against the self. And the absence of hope, although there can be depressing, of course, seems to do with the absence of meaning and purpose. Back to sort of what I do.
So then okay. I'm going to think about that.
I hope that, I apologize if that didn't make sense, because I was improvising.
No, it did. And I was thinking like, well, how can you see, I don't know if you change is the right words, but how can their internal, like, so if they have this false hope, this, fabricated self, as opposed to their authentic self, how what does one shift someone's psyche to go from fabricated self to authentic self? Like, you are not going to be the king of England, but maybe you can do this instead.
Right. I mean, you kind of hit the nail on the head. It's not that easy. I again, not to be controversial, I don't think it can be done in one session. But what you're doing is you're converting. Yes, you're transforming, you're converting, you're transmutating, whatever word you would use. And that process, although held within the frame of the treatment by the therapist or analyst, it has to be done by the individual. So for them to we would use the word grief, right? All therapy is grief work. And I stand on that. I would fight on my mountaintop for that, because you're grieving fantasies that all the time. You're grieving old ways of being. You're mourning dynamics that maybe you grew up with, or dynamics that meant so much to you, to make room for your own authenticity or development if we don't know ourselves so fully, which is the case for all of us, because we contain many minds and the unconscious is real. And so making that change, like you're saying, is very difficult and very challenging, because to go from A to B, you have to grieve A. You also have to build a bridge to B. You also have to have the courage to go to B. Talk about resilience and then B itself. And it's in its hope that it provides. It also has to be authentic or congruent or have the sort of capacity to map onto what the person's actually capable of. So you were about to say an example with the King of England, and that could be an exaggerated fantasy. It could be a sublimation of a wish, a reaction formation, if everybody, listeners, remember ego defenses. But what matters isn't the jargon. What matters is that maybe that's a pursuit of wanting just to feel powerful. And in reality, they have this capacity to feel powerful in pursuit of their own, let's say, I don't know, an academic career. And they become a professor, and they're well respected in their field of geology or anthropology. But has nothing to do with the king, or maybe it would be more akin to history, because King of England in the United States. But their King of England fantasy is all about hedging against feelings of inferiority, or feelings of castration, classically speaking, feelings of just being ineffective, to speak plainly, and getting them into a position where they can tolerate a reality that not only is the fantasy meaningful, and not only are we respecting it, and not only did it provide you hope, but we're going to use all those variables in service of helping you to see what's really going on in the totality or in the tapestry of your whole mind, which includes the parts that you don't know yet. And people get very anxious.
The parts you do not know yet.
We don't know ourselves. I mean, this has been substantiated in the neuroscience, which is a fancy way to support my biases, but it is true nonetheless that the brain is organized in a way, if you study theories of what gives rise to consciousness or why the lights are on at all in the first place, consciousness is not the totality of our experience.
Right.
Which is just to say, it's a depending on what theory you want to look at, it's like a lighthouse, and the way the light is focused is what we're paying attention to. But there could be a million things going on in the background, and who's in charge of where the light is pointing on the on the ocean, and on which ship, and also the aperture of the light when it's opening and closing, and how focused is it. So the classic examples of learning and unlearning and the autonomic nervous system stuff. And I could keep going, but the point being is you don't think about your heart beating. You don't think about your diaphragm expanding and contracting. You don't think about putting one foot in front of the other. That's an unconscious process. But to a 10-month-old or a 13-month-old, it's very conscious.
Right.
So once it's learned, this is, again, all these principles in the neuropsychoanalytic stuff, it becomes integrated. And so it no longer is available to awareness. A lot of the work we do is I wouldn't use the word unlearning because it sounds kind of yucky, but it is bringing things into awareness that haven't been for some time. So the King of England fantasy is a good one, where maybe that's all they think about, but the thing that's fueling it, or the many variables, I should say, that are fueling it and fueling their hope, might be something they haven't felt, just like the heartbeat, the lungs, or walking in a lifetime, not since they were a kid, or not since they were a teenager, or not since their first job, their first kiss. You know, that's what has to be appreciated. You know, memory is not always conscious, but when you wake up, all your memory comes back every morning. Hopefully.
Yes. Hopefully there. So it's bringing that to the forefront, making it conscious, and even just like kind of unpacking and bringing up like, well, maybe this individual that wanted to be the King of England or wants to be the King of England also wasn't heard, didn't feel seen when they were a child, like whatever it could be. Yeah. Like, again, I just picture it's like a tree, like it's the root, and.
Yeah. I mean, there's I attended a Freudian institute.
I'm Jungian.
Controversial either.
Actually, not
really. And no, but Jung would say that I adore, I truly love and passionate about that Jung's quote about for the tree to reach to the heavens, it has to root itself in hell. And what he's speaking to is the reality of not only what he called the shadow, but the reality that to get to know the self fully is to get to know the parts that we don't want to. So the fantasy, back to hope can be a prophylactic. I am just, all I am is hope. I'm a hopeful person, and I'm optimistic, and I'm even maybe mawkish, or I'm cloyingly nice to people. Hope. And I don't think you have to be a psychoanalyst to know where there's the sun, there's the moon. And that person might be defending against a prolific amount of anger, rage, rejection, sadism, pain, and suffering. And I have the utmost compassion and sympathy for that personality. But nonetheless, it would benefit to integrate those things and appreciate that that person is much more complicated than their eternal optimism or hope leads on.
Yeah. So this is how hope can be dangerous, or to soften it, unhelpful.
Yeah, it could be an obstacle.
An obstacle.
Yeah. Sure. Yeah. Absolutely. Yeah. It can be. I've experienced it professionally. We spoke to flight into health in our first interview, and the flight into health is a fairly common. I don't know statistically how common, but I found somebody, a therapist who understands me. I feel seen. I feel heard. These are constructive things. We want that in the frame, but by those variables alone, I feel better. And then that person then says, it's session 8 or session 15, and they leave because they have flown into this position of health, which you could call it a flight into hope. Maybe you should, and that would be why this episode goes viral. But the point being,
there we
but
go.
it's the same difference, in that it's an idealization of the process and a devaluation of what the work, the heavy lifting, truly actually entails. And so somebody might fly into that position really quickly in a sort of simulation of hope and resilience. I feel so much better. I feel so strong. This person understands me. You've helped me so much, Dr. Max. See you later. And that happens sometimes.
Yeah. Flight into health. And that's that false hope, or that sense of hope that may not be based in any depth.
Right. It might not be grounded within themselves.
Yes. Yeah.
And the falseness gets tricky because so much of our perception involves falsehoods. You see the world, like Gandhi said it, right? You see the world not as it is, but as you are. And so a lot of our percepts, our frames of reference and perspectives can be false-ish. So, false hope also gets controversial if you were to be really nitty-gritty about it, or a real stickler, because sometimes a false hope, yes, it's not grounded in the person's actual capacities or authenticities, but it's not false in the sense that it is providing them a buttress of sorts to keep them upright.
Yeah.
And that dynamic can be invaluable to somebody, let's say, who's lacked resilience or what has been through a lot of struggle in life.
Again, it goes back to it's very resilience, and hope is very interconnected, and that leads to healing. Well, Max, I feel like we can keep talking for another hour. And I remember, like, when we first met, I was like, oh my goodness, I'm learning so much. And there's just so much to unpack. So I really appreciate that you came on to, the podcast to give a different perspective about hope. And with that being said, I'd like to end my podcast with the same question for everybody. What brings you hope?
What brings me hope? Just in general, you're asking. But what brings me hope is fighting this fight. I don't want to sound so cliche, but it's true. What brings me hope is the good fight for meaningful therapy. You could people in my personal life know that, and hopefully professionally too. And it brings me hope to see people in the field that are really fighting, not against each other, but fighting for, the sort of helping profession of what it is to be a psychotherapist, for irrespective of modality, but to robustly, actually, and long-lastingly help a person. It matters so much more than I think people realize in our world right now. People speak to the virtue, right? To bring that example again, bring it back to that, where mental health is, mental health. That word has become meaningless, and people are not appreciative of the effort, the boots on the ground effort it takes for the everyday therapist to do this work, especially if they lack the resources, or don't know things that they don't know. And what brings me hope is the people I admire in the field that are prolific with this and lecture and teach and so on, and talk about how to make therapy as effective and meaningful and powerful and hopeful as it ought to be. The science of subjectivity, the science of psychology is real. It's rigorous.
Yeah. And it's needed, especially nowadays.
It's needed more than ever. I mean, you don't need to bring in the really saddening statistics about, I don't even want to say all the metrics that they use, but we all know what I'm implying when it comes to different versions of suffering, individual, family, country, you name it. It's bad. It's a bad situation.
Yeah. Yeah. And so thank you, for the work you're doing, the work all of our peers are doing, and instilling that hope, teaching resilience so that people can heal. So, and
I would, teaching, respecting the reality that an individual has the capacity to heal, and has authentic elements to their own vitality.
Yeah.
It's like that. It's almost that simple. Each person. This isn't like, Sesame Street talking about you're special. That's not what I mean. It's not a virtue. It's a reality that people have this capacity. And it's just hard work to get there.
Yeah. Hard, deep, meaningful work. So, well, thank you for being on here, and, definitely have you back.
Thank you for having me. Thank you. It means a lot. Am I allowed to say this was my first podcast?
If you want to.
I do. This is my first time being interviewed formally, and I really appreciate you gambling on me. It means a lot. It really does.
Oh no, it was amazing. It was fun, and like I said, you can come back for your second podcast interview.
Awesome.
Or maybe it'll be your 100th when I, have you back on. Who knows? Yeah, and I'll, have information in the show notes if for whatever you want to share. But thank you again for being here, and I hope everyone has a wonderful day. So yeah, that was a fabulous episode. And to learn more about Dr. Max, you can go to his website, meaningfultherapy.org. And, there's information there about psychodynamic work. And again, feedback is always recommended. So please leave a review or follow us on Instagram. And I will see you in a couple weeks with another episode. Thank you. Thank you for listening to Hopeology. If you enjoyed today's show, please leave us a review. To learn more about us or listen to past episodes, you can find us on all your podcast streaming stations. If you are interested in being a guest, or if you have any feedback, please email us at hopeologypodcast@gmail.com. You can also support our show by clicking on the link in our show notes. Please also follow our Instagram page, Hopeology Podcast, and visit our website, www.hopeologypodcast.com.